Okay, so this is skill 1.26, assessing the peripheral vascular system on a person, a client. So the first thing we're going to do is we're going to perform WIPSA, okay? What are you going to need any supplies for this? Just your hands. If there's a problem with the skin, or you may feel like you're going to come in contact with some bodily fluid, you may put gloves on, but overall you really don't really need them, okay? All right, so you're going to perform WIPSA. You're going to then inquire about the client's history of the following. You want to know about their past history of heart disorders, varicosities, arterial disease, and hypertension. You want to know about lifestyle habits, such as exercise patterns, activity patterns, and tolerance, smoking, and the use of alcohol. All of those items contribute or play some sort of a role in the peripheral vascular system within the body, okay? So you want to know the history of your client, okay? If you haven't been able to find it in the chart, ask your client. They may be able to tell you, okay? So then the next thing we're going to do is we're going to palpate the peripheral pulses on both sides of the client's body. So what are the peripheral pulses? Okay, well, they are the carotid, the brachial, the radial, the abdominal aorta, the femoral, the popliteal, posterior tibial artery, and the dorsal pedis. Okay, so palpate the peripheral pulses. What does that mean? That's right, it means to feel, to touch the peripheral pulses. Okay, so we want to, when we assess pulses, we want to assess the same pulse on both sides of the body at the same time. Okay, there is an exception to that rule though. Okay, and that's for the carotid. Now I'm going to pick up the camera, so you're going to have a little bit of movement with the camera now. Okay, all right. So the carotid is on the side of the neck. So you're going to feel about right in here. See this right here? Okay, you're going to feel right in here for a carotid pulse. Okay, can you imagine if you were to do this on both sides of the neck? What would happen? You have now occluded, if you are pushing on the carotid on both sides of the neck at the same time, you are going to occlude all of the blood flow to their brain. No blood flow to the brain means passing out from your patient. Okay, we don't want that to happen, okay? So never palpate the carotid pulses at the same time, okay? The next one is the brachial artery. And the brachial you're going to find on the side of the upper, inner aspect of the upper arm, right in here, okay? The mannequins have this wonderful little area. See how this area right here is where you're going to find your pulses. And if you feel on there, you're going to feel like a little mechanical give, okay? And that's where you're going to actually feel the pulse, okay? So get used to that for your mannequins. You're going to find the same thing on people. May not be as easy to feel on people, okay? Especially this area for adults. It's used majority of the time for children and infants, okay? But for little old ladies, we may use this location as well. Okay, so that is the brachial, okay? Then we're going to move down the arm to the radial. This is the radial right in here, okay? And this is where you're going to find for the radial pulse, okay? All right. And then the next is the abdominal aorta. And you're going to find that in the upper abdomen retroperitoneal area. So about right in here is where you're going to be feeling for the abdominal aorta, okay? And then we have a femoral. And the femoral is going to be right here in the groin section, okay, of the leg. Okay, so that's going to be the femoral, okay? The next, you're going to find this part of the mannequin and this part of the mannequin are for IV access, okay? So those are not for pulses. Neither is this part. This is for injections, okay? Okay, so then the next one is going to be your, sorry about that, is going to be your popliteal, okay? And the popliteal, you're actually going to feel behind the knee, okay? All right? So I'm going to pause this and put this on a stand so that I can show you the rest of the pulses on the lower leg, okay? Because it really requires the use of 2 hands, okay? So hold on. Okay, so the popliteal is behind the knee, okay? And what we want to do is we want to put our hands, like, can you see? Yes. We want to put it behind the knee. You want to flex the leg, okay? And you want to put your thumbs on the top of the knee, okay? And you're going to feel behind the knee, okay? The limp of the patient actually has to go limp in order for you to feel this. So you've got to tell them, you know, go limp, okay? All right, so that's the popliteal. The next is the posterior tibial artery, okay? So the posterior tibial artery is down at the in the ankle, okay? And you're going to feel that at the ankle region. I don't know, can you see? I'm trying to make it so that you can see. Okay. So you want to be along the inner aspect of the ankle. I think I may have that wrong though. I think we've got to go on the other side of the foot. Hold on just for a moment. Yep, I was right. So for the posterior tibial artery, it's easiest if you're at the foot of the bed and you flex the client's foot out, okay? And you're going to be feeling along the bottom of the ankle, okay? And that's where you're going to find that artery. The next one is the pedal, the dorsal pedis, okay? And you're going to find that on the top of the foot, okay? And different locations for different people. Just feel around on the top of a foot. You should be able to find it midline. So midline of the, I guess the first toe next to the big toe. Go up towards the ankle. You're going to be finding it about right in here, okay? So that's the dorsal pedis, okay? Again, you're going to check both sides of the body at the same time. So you've palpated the peripheral pulses. Now you're going to inspect the peripheral veins in the arms and the legs for the presence and or appearance of superficial veins when limbs are dependent and when limbs are elevated. So how do you do that, you say? Well, I'm going to turn the camera. Okay? Let's see what we see. I got to check. Okay, you're going to check by lifting their arm up. You're going to check the veins, see how they are. Do they bound out at you? Do they go away? You know, check for bruising, okay? You're going to check the arms and the legs. You're going to check the arms and legs for color, temperature, edema, skin changes, okay? You're going to inspect the calves for redness and swelling over vein sites. You're going to palpate the calves for firmness or tension in the muscles, the presence of edema over the dorsum of the foot, and the areas of localized warmth. You're going to push the calves from side to side to test for tenderness, okay? Just like, oh, you can't see that. I turned the camera again, okay? So you're going to push on the calves, okay? And see if there's firmness, if there's tenderness, okay? You're going to firmly dorsiflect the client's foot while supporting the entire leg in extension, okay? So that's like this, okay? What are you doing? You're checking for, you know, whether they have tenderness, okay? That could be a sign of a blood clot in there, okay? We don't want that, okay? Again, check the hand. I've already said this. You can inspect the skin of the hands and the feet for color, temperature, edema, and skin changes. You assessed the adequacy of arterial flow. You would assess the adequacy of arterial flow if arterial insufficiency is suspected. How do you know that? How many of you have seen a patient that has brown skin, or an older person has brown skin on their calf? Okay, that's a sign of arterial insufficiency. Okay, that means that the blood flow is not as adequate to the lower legs anymore. Okay, and so their skin becomes depigmented. Okay. You're going to check for capillary refill and inspect the fingernails for changes indicating circulatory impairment. You're going to check both the feet and the hands, okay, for that, okay? You're gonna wash your hands, remove your gloves, remove your gloves if you put them on. Wash your hands regardless. You're going to cover up your patient, make them comfortable. You're going to make sure they have the call bell. And then you're going to document your assessment findings in your client's record. So that is scale 1.26, assessing the peripheral vascular system.